All right, good afternoon. You are welcome to our introduction to basic laboratory techniques, BDT 151. And I believe that before now that you've been given the course outline, right? Right? Good. So we'll take it step by step. I know that you have done one or two things. I just want to go back for the benefit of those that are still floating, those that didn't get anything much from what was said. That's why I'm going back. If not, I will just start from where we stopped. But let me just go a bit back. Now, I want to let us know something very important. That the entire exam is 100%, right? The entire exam. Your CA is 40%. Why you are, what do you call? Why the main exam is what? 60%. Under normal circumstances, we do have mid-semester exam, which the second year they wrote the years last year. But because of how this, if you watch previously, your exam was supposed to be in January, but there was some changes that's where we concluded that all the exams for the first semester, all the classes, the exam will be in what? December. So that after the exam, you go home and eat your Christmas rice, gallivant, and enjoy yourself without thinking of any exam. So when you cruise finish, 9th January, you are here. Yes, if you like, continue cruising. Once it's 9th January, lectures is starting that day. There's nothing like 1 week. That thing you are doing in accessory school. First week, school is not serious. 9th day of January, I am in this class. If you're not here, I will teach empty seats. After teaching empty seats, I will not teach it again. So 9th January, you are here. Lecture starts. Open it. You are not giving me the password, but there the cafe I left here. Now, the 40%, because of there will no mid-semester, the 40% will generate it here. Will generate the 40% to what? Here. And there is nothing like I will continuously assess you. They call it what? Continuous assessment. Where I am is actually what? Continuous assessment. All the topics, you have quiz in all the topics we will treat in this course. And this is how we'll be doing the quiz. The quiz is not give me, I'll call you out here, ask you a question, you tell us the answer. If you get the answer, I will score you. It's not you go and be cramming one thing like that, after cramming you come. No. You study the topic. Once we are done with the first topic, as I'm entering the class the next day, you start your quiz. I'll just call it out, ask you a number of questions. As you're answering, I will score you. When you are done, you go and sit down. This is what we do for all the topics in this course. So if you have not been studying, you start doing what? Studying. Not in my course. Not in what? My course. Please, I am begging. Where you are jacking shoe, they call it jacking shoe. Because you need to jack, you need to study. I don't believe in maybe towards the exam 2 weeks you studied it. No. If you are that type, better change it now because you won't even know where the question will come from. So as it is hot, as the lecture is going on, I am compounding questions for you people. Immediately after that topic, Of course, in my question bank, I have up to 1,000 questions for this course alone, waiting for you. So that one is not even, I'm trying to make it up to 2,000. So question day. So prepare your mind to study. Study well so that you do well. At least if you get A, it has never happened in this school that you scored A in my course. You don't know the course. It's not possible now. No. The system I will set, the system will make you to know it. The system. I won't even first on the system. As you follow the system, you see yourself. You can discuss it, talk about it, and be proud that you did discuss. Okay? Now, in my class, please feel free to ask. I enjoy interactive class. Logical and interactive class. Ask questions if you are confused. Don't be ashamed that you don't know. Okay? But still, what matters is that you follow, you ask questions. Don't keep it to yourself, because there are some people that have this complex because they don't know whether they will laugh at it. No problem. Ask it. Ask the question. I will explain. Okay? So, that's the way of what? Introduction. All right. By the special grace of God, my name is Pharmacist Isaiah Emmanuel Chetana. I'll be taking you on BDT 151. I'll also take you on BDT 152 in your second semester, unless other engagements get me distracted. Then, if not, I will take you in that course, and I'll also take you in your farm CAC in your second year. So when I drill you in first year, I will drill you in second year, first semester. I will be confident that this set of human beings I'm sending to the hospital will do us what? Proud. And you'll be happy I shared many hours of my life with you. Because as I'm here now, I want to share 2 hours of my life with you. Hope you know. And we are sharing 2 hours of your life with you. Hope you know. Good. Now let's look at what we have. Dispensing. Good. What is dispensing? You've done dispensing. Yes. What is dispensing? What is dispensing? Okay. Is what?
Dispensing the process of preparing and giving medicine to a new person in the basis of prescription.
The process of preparing and giving medicine to a named on the basis of what? Good. That is what dispensing is all about. Dispensing is not only giving somebody a medicine in that pharmacy. Maybe you are doing your IT there. Not only it doesn't end there. Am I completing? The moment it starts for the preparation of that what? Medicine. The preparation initially you've done PTP, right? Before now, those days, there was not like this prefabricated dispensing we have now. We are from a school company. We manufacture a particular medicine or produce a particular medicine, package it in sachet, if it is tablet, or in bottle, if it is what? Syrup, and in cartons, and send it, distribute it to different hospitals and what have you. Those days, if you are sick and you go to a doctor or a herbalist, what the person will do is to just go to the backyard. Am I communicating? Having clacked the patient, go to the backyard, get the leaves or get the ingredient you want to use, and right there you prepare the what? Medicine, and give to the what? The patient. We call that extemporaneous what? Dispensing. You call that what? Extemporaneous. Now, but with time, I can remember when I was tender. I think I went to Abakaliki that time. One of my uncles, Abakaliki, I went for holiday. I can remember that time. We went to one hospital. What they gave to me that time was they just prepared the drug and poured it in bottle. Hospital and gave to me that time. That time they didn't know. It was not what we see today. That time. So as at that time, the hospital was still doing this extemporaneous dispense, but it's no longer common now. It's no longer common due to the era of industrialization and increase in the human population. The need for industries to start formulating these things and package them and distribute, export or import to different parts of the world became necessary. Am I communicating? In fact, it got to a point that even the leaves or the parts of the plant they were using then, now tell me how can they even be enough to take care of the medicine needs of human population? You know how many type of fields you have to be able to harvest the leaves or the roots through which you can get the drug that you can use to formulate a medicine that will be enough for the geometrically increasing human population. So at a point they had to resort to what is called synthesis of these drugs using what is called, in the aspect of pharmaceutical chemistry, they call it drug synthesis. That is the actual meaning of drug production. Are you aware that drug and medicine are not the same thing? Are you aware? Don't worry, you still know. Let me not take us far. Let me be in line with what you are doing. Don't worry, we'll get there. But drugs and medicine are what? Not the same thing. Hey, secretary, phone now here, no one. Agba phone now. Never musubu. I want nobody phone can use. I pressed it to quickly record it. Then I am pressing on you. The operator is a press. Oh, it must be a press. Can press it. Now, even the code on himself. Let me keep it here. Otuka. There's something I want to know if I'm getting out of. So how did you do this now? Show me.
For example, you want to open it. You do like this. Press it in the middle.
Okay, again and again.
Just press it in the middle. The code will come.
Okay, all right, thank you. Even come. Here, get that thing. Okay.
It's not like.
Yeah, thank you. All right, now. Let me come back a bit. I got fed up now. Let me come back a bit. Let me go back to the next paragraph. Now, there's something I want to explain here. This paragraph says that it involves correct interpretation of the wishes of the prescriber, as well as accurate preparation and labeling of medicine for use by the patient. You know, the prescriber is the doctor, right? Yes. The doctor is actually the person that's what is called clerkship, clerking a patient. Maybe on the bedside, the doctor is going to examine the patient. From the signs are what the doctor can see. And the symptoms are what the patient complained to the doctor. Headache is a symptom. It's not a sign because you cannot see headache. Yellowish sclera is a what? Sign you can see. Am I communicating? Fever is a symptom. You cannot see fever. True or false? Good. Now, It's the doctor that actually examines the patient. It's the doctor that actually knows what he wants to do, what treats, and why he's prescribing a particular medicine or medication. Now the doctor there's something he has in mind, he or she has in mind to achieve by writing a prescription. So you as a pharmacist or you as a pharmaceutical technician that receive that prescription, you should be able to interpret the wishes of the prescriber. Am I communicating? Is when you correctly interpret the wish of the prescriber for prescribing that particular drug. That's when the patient will do what? Benefits. So that means you will read the prescription, interpret the prescription. If there is any error, whatever, you assess it. If there's any error, whatever, you call the attention of the prescriber, make the necessary correction. And now, if it is the one you need to compound, you compound. You compound the medicine before giving. If it's not the one you need to compound, you just simply do what? Go to the where the shelf, where you have the medicine and do what? Collect it and do the necessary and package, give to the patient and cancel the patient, and you have done what? Carried out what? Dispensing. Am I communicating? Then the patient will now go from the direction of use, the patient will now use the medicine and achieve the therapeutic purpose. Okay?
Yes, sir.
Child. Now, where does this thing take place? This thing called dispensing. Where does it take place? Is it in your yard or in your backyard? Where? Is it in office worker? Where? It takes place in premises approved by what? PCM. What is PCM? Pharmacy institution. Pharmacy. Huh? You say? Pharmacy. Good. Is pharmacy. It was pharmacists, but it was changed to Pharmacy Council of Nigeria, PCN. Now, these approved places can be hospitals, be private wards. It can also be community pharmacy. Those ones use like past pharmacy. You see on all these places are approved by what? PCN, where you can carry out the process of what? Dispensing. You see how drug is being respected. You know, it's not what you just do anyhow. Just to be able to carry drug, dispense drug, formulate it, you go to school, study about drug, medicine for years, because it's very, very important. It can save, it can kill, depending on how you do what, use it. It's a two-edged sword. You can kill, it can do what? Save. Drugs are poisons. Two of us. Are you aware? No, you're not aware. We are you aware? Before. Good. So you're confirming it now, right? Good. So drugs are what? Poison. Now, you are here now as a pharmacy technician. Students. One thing you should know for you to be able to practice. See, there's something I don't like in my class. Please, if you're in my class, don't put your head on your desk. If you are not feeling fine, go to your hostel. I'll permit you. If you are feeling sleepy, stand up, go around, walk around. You don't put your head on your desk in my class. I don't tolerate that. Hey, get up. Get up. Get up. Then go to the hostel now. Start going to the hostel. Go there and rest. Take your rest in the hostel, not in the class, okay? Or yeah, go to the hostel. If you cannot, they'll help you and take you down to the hostel. If you are here, you are what? Here. If you're not here, you're not what? You're not here. You can't be in my class and they say that you went to school to lecture. No. No. You must actually be here. Huh? You can go, no problem. You can go. Feel free. If it's only one person that is in the class, no problem. But the person must be active. Okay? If you are feeling sleepy, just walk around and listen to the class. Okay? Don't put your head on the what? Desk. I don't like that. And sit as if you are in a class. You're just in a beer parlor. You're not in your boy's friend's house. You are in my class. Sit up with your pen in your hand and you're putting down something. That's how to sit in a class. Please, hey, Kafia. Sit well. You see, your position affects you, but you don't know. The moment you are like this, you have gone. She wasn't here.
I was
And she called me ma. No, it's not a joke. This is my job. This is my life. This is what I represent to teach, nothing else. The way you sit affects you. Your assimilation, you won't even know. The moment you shift, you have gone. You think you are still here, but you're not here. I have been here for the past 1 hour or so, 30 minutes. She called me ma because she wasn't here. See how she was sitting. That was why she subconsciously, ma. Had it been she was here, she would have said, sir, please, that's why I don't tolerate that. If you are tired, you can go and rest. I will permit you. I am not the type that force you must sit down here. But the importance of this class will make you to sit down by force, not me. Come in. Not me. Okay, I think our class will stop here for now. We'll continue. But remember, if she mistakenly leaves here by 2:30, I'll come back.
We'll be going by 5.
All right, thank you very much. God bless you.